Hello everybody, my name's Gary Jones and I'm the Chief Finance Officer of Stockport CCG. I'm a qualified accountant who's worked in the NHS now for 22 years. The last 10 years I've worked in Stockport, 8 as Deputy Director of Finance and the last 2 years as Director of Finance. I see it as my role to ensure that the funds that the CCG receives, which is taxpayers' money, are used efficiently to achieve the best healthcare for our population. So who do we commission services for? If you live in Stockport and are registered with a Tameside GP, it is Tameside CCG that pay for your healthcare. If you live in Tameside and are registered with a Stockport GP, it is Stockport CCG that pays for healthcare. So the overriding factor is which GP you are registered with. So if you're registered with a Stockport GP, Stockport CCG will pay for your healthcare. We have around 300,000 patients registered with Stockport GPs. The coming year the CCG will receive around £360 million. That's spend of about £1 million a day. As a CCG we are not allowed to spend a penny more than the £360 million that we receive. We can break down the spend of the CCG into 3 main areas. There's care in hospital, there's care in the community and there's the cost of drugs. So for people needing care in hospital setting, this covers things like planned care, that's where people book appointments, emergency care, where people need access to A&E services, day case procedures and outpatients. The cost of those services is about £250 million a year. The second area is care in the community, and this is mainly where people have been discharged from hospital and can be cared for within a community environment. And these people typically have issues with long-term conditions and need to be cared for in that environment. The spend on that area is about £45 million a year. The third area of spend is the cost of drugs issued by GPs. So every time you go to your GP and you need a course of treatment, antibiotics, the cost of all those drugs is met by the CCG, again, and that's £45 million a year. The challenge we face as a CCG is managing the growing demand for our services and at the same time recognising the uncertainty that we face on the future funding that the CCG is going to receive. It is important that those people who need access to health services receive the right care at the right time, the right place, and that these services provide best value, high quality and safe care. Thank you.